Was doing very well. Her base of support she can able to manage in the flat surface while climbing upstairs. She was telling like the very next week of therapy session, I'm feeling well, I can walk very fastly. Everything she was like appreciating. Hello, I'm Rizwana Parveen, physiotherapist from Newrorehab. Ms. Rekha, 70 years old female, a patient with some balance issues and gait disorders. Like usually in elderly people, we can see that these kind of things. Whenever she is getting up from the bed, whenever she is turning around, whenever she want to stand up from the chair or walk around, she was feeling very lonely. At the same time, she feel like something happened to her. She was about to fall down. Everything is going in her mind for the long period of time. So exactly what happened to her it is, if she is doing any activity she couldn't pace out. Like if she doing a single activity she want to take rest at least for 5 to 10 minutes. Her cardiovascular endurance is very reduced. It's also an age related thing. At the same time, her muscle weakness. She is a left side dominant type, so for the long period of time, she feeling some sort of muscle weakness all over her body. She couldn't do any activity by herself, and she was staying alone in her home. That also caused some psychosocial factors. Psychologically, she feeling very alone. At the same time, she is feeling very weak. So she wants to do something. She feel like pain all over the body. She couldn't do anything. At the same time, the psychological thing keeping confusing her, mixed her up everything. And she was initially consulted for a shoulder pain through some medical type. She was taking care of the shoulder but not going up any physical therapy, she told before. And then she came again for some balance and coordination issues. If she felt like she was about to fall down, whenever she stands from the bed, whenever she stands from the chair, she was about to fall down. And there is no one here to me catch, there is nothing around me, like that. And her posture, everything is were like stooped posture. She can't able to look forward straightly. She was looking down while walking. Her knee was about like bending. Everything is like an age related criteria. We can sort it out. It's like an age related criteria. Geriatric patient usually had these kind of problems. They will be having a postural instability, dynamic balance stability. For her, a static balance is also, she felt like she is about to fall down. So initially we assisted with the Berg balance scale, BBS. It was about 48. She was about moderate level, and then we trained her for 3 weeks. Completely started with the strengthening criteria. At the same time, psychological counseling in between, and she was about to take an RF session here and instructed some home activities also. She was doing all the activities initially with some active movements, isometrics, at the same time some resisted exercises mixed up with some balance and coordination exercise, everything she was doing. Now she was doing better. Now her BBS rate is about 52. So while tandem walking, while she closes her eyes, she was feeling she was about to fall down. But if she is open her eyes, if she do all the activity, she was doing very well. Her balance is improved very well. Her posture is improved very well. She is walking very fast manner. Initially, her breathing pattern, she was about to pacing, about to take breathlessness, but there is no breathlessness in her. It was amount 50% of her breathlessness is reduced. But while doing higher intensity exercises like climbing up about the high stools. Now her BCS score is about 52. While closing her eyes, she felt like she was about to fall down. In her opened eyes, she was doing very well. Her base of support, she can able to manage in the flat surface while climbing upstairs. She was telling like the very next week of therapy session, I'm feeling well, I can walk very fastly.
Hello, good morning. My name is Rekha.
Why did you come here, ma'am? What was the issue before? What was the difficulty?
Issue means by walking, I I feel I am falling. I am falling. That's all. Yeah.
So after coming here, ma'am, have you felt better?
Ah, better. Yeah, full.
So you did only physiotherapy?
Yeah.
Physiotherapy
Uh,
and then
3 weeks. 3 weeks. Yeah, yeah. 3 weeks. Yeah, yeah.
is there anything else you would like to add? How was your experience? Can you tell us that?
Experience is very good.
everything she was like appreciating. And the major thing is she was feeling alone still now, even whatever exercises we trained for her, some social interaction requires for her. She was feeling alone in home, someone wants her to speak with her, interact with her. That's why she was very emotional when she thought it was like a last session. So we told her, like we informed her, ma'am, this is not a last session. Whenever you want, you can come to us. Whatever exercises you want to change over, we will be always available for you. So you can come with us whenever you want, whenever you are feeling lonely. So we will be always available for you. This is what I told her. So as a geriatric patient, apart from strengthening physical strength, mental strength is also very very important, because they will be very lonely even if they are having with their spouse or non-spouse, with their kids, grandchildren, whomever might be, they will be feeling very very lonely. So as a physical therapist, whenever we are interacting with our patients, we have to be take a little concern over their psychological status, and we have to improve their psychological status also. Thank you.